Greetings, everyone. I'm excited to talk to you about how I think the pandemic is helping us to reinvent health and well-being. First, I have to acknowledge that this pandemic has been hard. It's brought a lot of hardship, a lot of havoc, a lot of tragedy and loss. And while that is true, I also believe that the pandemic has provided us with tremendous opportunities. It's given us some new ways of looking at health and well-being within our communities, the roles we need to play in relationship to that, as well as the roles that organizations in our communities and government needs to play. And I think that the insights that are being revealed to us through the pandemic, if we take hold of them and capture them and are able to sustain those insights moving forward, we can actually revolutionize health and well-being in our society today. What I'm going to share with you are some of the insights that I think, the realities that have been revealed by the pandemic. I'm going to talk about why those are important and how I hope we can sustain those frames moving forward. What I think is also important to recognize is that the realities that I'm talking about today are not new. They've been around. People have been talking about them. People up here in the Northwest region of Michigan, in fact. It's just that in our day-to-day lives and the roles that we've had pre-COVID, we weren't able to give these realities the attention they deserved. And I'm hoping that I can highlight why it is important to do that moving forward. One of the realities that I believe has been essential to reinventing health and well-being is that the pandemic has brought to light the fact that we are all united in our humanity and that what we have in common is the shared commitment to health and well-being. And that's really critical because we as a society are a place that is so much more defined by our differences. We find them divisive often, in fact, and make it difficult to unite together around common goals. Now, certainly, the recent events of the Black Lives Movement and the protests around the world have highlighted that we have to pay attention to these differences because they matter. And sometimes we use those differences to create and ruin people's lives. But within the context of that difference, we often also have to find commonality. And what the pandemic has done is highlighted for us that we have, in fact, health and well-being in common. And what has happened because we've united around that, we've actually accomplished a tremendous ability here in Michigan, for example, to flatten the curve. Here is a map of the spread of the virus here in Michigan and the infection rate effective as of June 14th. And as you can see, green is low levels infection, red and orange are high levels. We've actually been able to slow the spread here in Upper Michigan. And why were we able to do that? Well, we were able to do that because we united together around this common goal of fighting the virus. And in the process of doing that, we realized that everybody has a role in promoting health and well-being. The governor gave us a lot of mandates, so did the public health department, about what we needed to do to protect ourselves and others in our community. But in addition to that, we took on an even more important role, I believe. And that was a role that was disrupting what we need to do in our community to promote health and well-being. And I want to highlight some of those disruptions that I think we've initiated and that I'm hoping we can continue moving forward in a post-COVID world. One of the ways that we've disrupted this is we have elevated the level of giving and taking care of each other, even of strangers, through this pandemic. We've seen rapid levels of mask making and people donating those for free. We've created matchmaker lists and communities on Google Sheets. I have a need, you have that resource, we're a match made in heaven. We've had food and diaper drives that have been created because people have been worried that people can't take care of their families and their basic needs given their loss of jobs. Communities have created donation funds, like here in this area, you've created the Urgent Need Fund that's housed in the Community Foundation. You've raised over $571,000 to date to take care of local needs. You have teens stepping in new ways. There are some teens from the East Coast that have created a national website linking teens in a community to elderly people they don't know, but those elderly people need help because they don't have any family nearby. And then there's the website that was created called Pandemic of Love, where it links any need that people put on a list to people in the community that have that resource. So again, huge levels of taking care of each other and even of strangers, and that because we've disrupted who we love and who we nurture in our community, we've actually saved lives in the process of doing that. Organizations have also disrupted their role. They've been repurposing their resources in new ways, and that repurposing is critical because by repurposing, we share the wealth. Here is a great example of repurposing. In a large urban area, there was a food pantry that was receiving a significant number of food donations. That was critical that they needed to be able to feed the individuals that couldn't have food. But they didn't have enough refrigerated space. And so a food warehouse and distribution company realized that in its parking lot, what did it have? A lot of refrigerated trucks. So lo and behold, they took those trucks to the food pantry's parking lot, and now the food pantry had expanded temporarily its refrigerated space. We're seeing lots of repurposing of resources as a result of the pandemic. Locally, one of the examples of repurposing that I think needs to be highlighted is you have in Benzie County an organization called Days for Girls, and that organization traditionally creates menstrual kits for girls worldwide. But they couldn't do their work in the process of this. And so they partnered with the fiber shed that is offered through Grow Benzie, because they had sewers, the fiber shed had materials, and they began to make masks. But they needed a way to distribute those masks. So they actually connected with Benzie Bus. Benzie Bus now had drivers and buses that were available to do additional things. So now those buses drive around the region, picking masks up and distributing them to a whole host of partners, from nursing homes to healthcare facilities and to other areas and people that need those masks. Since the pandemic started, they have made and distributed over 5,000 masks. This is what happens when we repurpose ourselves and our resources. Organizations have also been redistributing and coordinating their resources. This is really powerful because in a redistribution process, you're saying, I don't own this resource, I simply house it. And because you have a need for it and I'm not able to use it today, I'm going to let you have access to it. So there's lots of examples of this happening as well. Here's just one in this region. The Area Agency for Aging, in talking to its constituents, realized that a lot of seniors were struggling with their mental health because of the pandemic and the social isolation that it was creating for them. And there were not available mental health services and supports to them, and the Area for Aging was worried about that. They connected with one of their partners, the Community Health Innovation Region, who knew, in fact, that there were mental health workers available. The school-based health clinics used to have mental health workers, but because those clinics closed down, those workers were actually at home, and while they were still supporting some students, they had some time on their hands. So that Community Health Innovation Region, called the Shire, connected those mental health workers to the Area Agency on Aging, and now those individuals are getting their needs met. They're also getting referred to the Community Connections Hub, which is a resource in our area that provides and connects people to additional resources that they need. So again, redistributing resources, moving them from one location to another in order to reach our crisis. So what does this tell us about health and well-being? What have we learned through this pandemic? That we can achieve more goals when we disrupt how we define our role in our society and we disrupt how we use local resources. So I encourage you, after this pandemic, to ask people, how are you contributing? What's a different role you can play in order to promote health and well-being in our community? And I encourage local organizations to ask themselves, how can they be flexible with their resources? Because sometimes what you have in the closet isn't needed in your organization today, but another organization might need it to meet an urgent need in your community. I must also note that this disruption that I just described was really made possible because of the level of coordination that was happening in this region prior to this event, and in other communities as well. People were connected, they were networked, and because of those networks and relationships that they had, they were actually able to connect quickly and with each other, and they trusted when they shared those resources and those processes as well. So having in place structures and institutions and councils and coordinating bodies like the Human Service Coordinating Council, like the Shire and many others in this region is really critical to having that kind of fluid resource exchange process. Okay, insight number 2. Health is more than healthcare. This is not new. This idea has been around for several decades, but we keep forgetting about it, okay? There is a long body of research that shows us that actually clinical care, hospital and doctors, only account for about 20% of our health outcomes. Now, of course, that's kind of a silly thing to be talking about in a pandemic, and I don't mean to make light of the fact that the healthcare isn't important. It is. It's been critical. It's saved lives. But when we look at the overall units of health and well-being, morbidity rates, chronic disease, visits to the ER, et cetera, what we discover is that what counts the most is actually the purple there. It's the social, economic, and environmental factors that we live in. The things that have surfaced up through this pandemic that we've worked really hard to take care of for other people, okay? Making sure that people could get to doctor's visits if they had to, making sure people had the money to pay their bills, okay, because jobs matter. Making sure people had transit if they had to get someplace. Education matters, making sure people have quality education for themselves and childcare for their kids. Making sure people have safe and affordable housing, food, the list is long. These social, physical, and environmental conditions are strong predictors of health. Most people have needs in at least one of them at any given time. The more needs you have, the worse your health outcomes. And we live in a region, in a nation with a lot of assets and resources. And yet, even in a pre-COVID world, we had a lot of people that had needs in these social determinant of health outcome areas. For example, in just this region, in the 10 county regions in Northwest Michigan, pre-COVID 2018, 36,000 people were considered food insecure, not able to afford or access healthy food. There was a 40% gap in infant, toddler childcare. And most people spent between 54 to 61% of their income on housing and transit. When you're spending that much on those two resources alone, you're likely to have to sacrifice something else, such as paying bills, saving for something that you need in your future, and eating healthy food. So what I'm going to recommend is that just as we have flattened the curve because we've united our resources around a shared goal of health and well-being, I'm going to recommend that we do the same thing with these community conditions. We need to treat them like a pandemic. We need to bring and unite our resources together. And it's not that there aren't efforts to do that. It's that those efforts aren't strong enough and robust enough because not enough actors and stakeholders are aligning their resources around this shared goal. Internationally, where we see success in this, we see communities have adopted efforts to help them unite around these shared goals. They've adopted things like health and all policies. They've helped organizations develop a corporate culture of health. So every organization, no matter how large or small in a region, thinks about and takes policies and practices in place that help promote the health of their employees, the people they serve, they take care of their local environment, and they're also taking care of their community's health as well. We also see communities and nations starting to develop what are called wellness budgets. Instead of just having budgets for police and taking care of crime, let's also have budgets that help promote wellness for the individuals within our community. If we do these things, we have to keep ourselves accountable to this work, and we have to be making sure that whatever solutions we design, they're driven with the needs and interests of the residents that we're trying to serve. So we have to be creating committees and task forces that engage residents directly and driving the solutions that we fit. Okay, so treat the conditions as a pandemic. Now, there are these conditions I just noted that we have to have in place. What we also know resoundingly is that access to healthy conditions is uneven in our society. And because it's uneven, we have tremendous inequities in all outcomes that you look at. Simply put, where you live matters. We have some communities that are healthy and some that are not because of the kinds of conditions that are in place. Here's one map of Michigan just to illustrate this. This shows us the percent of children that have low access to grocery stores. Blue means you're doing good, you got high access. Red and orange means you have low access. As you can see, very disparate realities around food access here in Michigan. So place matters. And because place matters, we're seeing significant inequities and also COVID-19 as well. So for example, there was just a study done with 12 states, Michigan was one of them, in which they looked at the zip codes where people lived. And they tried to identify, given your zip code, what is the incidence rate of this disease in your neighborhood? And what did they find? They found that if you lived in a neighborhood, one of the poorest zip codes, your rate of infection was twice as high than those neighborhoods that were the wealthiest. And if you lived in a neighborhood where there were people of color, and that was the majority, your rate of infection was 5 times as high than if you lived in an all-white neighborhood. So what does this tell us? Why is this happening? It's not that low-income people and people of color live unhealthy lives. It's that we've created in their neighborhoods unhealthy conditions that perpetuate these inequities. It's how we've financed education in the past. It's where we build the best housing. It's where we place the good jobs. It's where we put transportation hubs. It's where we put the best grocery stores. We need to start to make different decisions in our policies and practices so we can undo the inequities that have been accumulating inside these disadvantaged neighborhoods. So the other thing we have to remember at all times is that it's not only that these uneven conditions exist, it's that the solutions we design all the time actually grow these inequities, okay? Here around COVID, we did a couple of things because we had to, okay? We had to make school and work online. Well, what do you need for school and work to be online? You need a computer and you need internet access. Well, some rural communities don't have good internet access, so those families had a harder time doing education and working. Low-income families often don't have internet access or a computer. They struggled with this solution as well. We also, and this was a rapid innovation, we created drive-by testing sites. Very important to do, but what did we discover? Because of those drive-by testing sites, you had to have a car. Who's most likely not to have a car or a reliable car? An individual who's poor. And so again, solutions that were needed, but designed in ways that disadvantaged some groups and advantaged others. We also sheltered in place, and if you lived in crowded housing, you were far more likely to be living with somebody who was either infected or at risk of infecting you because there wasn't space to do any kind of quarantining. So how do we deal with this? We need to be diligently designing equitable solutions. We need to be thinking about equity at all times. And there's a couple of ways we can do this. John Powell has a great concept called targeted universalism. And in this idea, when you're designing your solutions, you're asking yourself at all times, how might unique subgroups of the people that I'm trying to serve have different needs and concerns? And how do I design a variety of strategies to meet those unique needs? We also can use something called equity impact assessments. In these equity impact assessments, we're asking ourselves a set of questions at all design stages and implementation stages of an intervention to make sure that we're not promoting inequity. We're asking questions like, okay, if I put this out in the world, who might be advantaged by it? Who might be disadvantaged by it because they can't use it or doesn't meet their needs, and why is that? And given this, how can we intentionally reduce this disadvantage? So, the pandemic has given us this opportunity to see things that were already there, but they've heightened their realities during this pandemic because we've been in a crisis. Let's not waste this crisis. Let's continue to have this frame on and sustain it so that we can be asking questions as we leave and go out and talk to our friends and families and have conversations about things like, hey, health matters to everyone, but everyone does not have the same chance for health and well-being. Hey, our community conditions should be promoting health and well-being for everyone. So let's do something about that. Let's advocate. Let's change our policies and practices. Let's make sure that what we put in place is equitable for everybody. And let's keep each other accountable. And finally, let's remember that everyone has a role to play in promoting health and well-being. And what is your contribution going to be? So to wrap up, I just want to remind us that we can and need to reinvent health and well-being. And this pandemic has given us a tremendous opportunity to do it. Let's not go back to the way that we used to do things pre-COVID. We're going to want to, it in our own minds seemed easier. The pandemic has given us an opportunity to rethink how we use resources, who has what role in society, what matters when we contribute, when we're thinking about health and well-being, and also how important it is to be creating equitable conditions so everybody can thrive. Share your stories about what you're doing to make those realities happen inside your community, and visit Sustain the Frames. Thank you.